Hi, I'm Emily Chandler, licensed marriage and family therapist based in Oakland, California. And I do hope that you watched the two previous videos I made. I'm making a series to help clients who are dealing with anxiety and panic attacks. The first component is learning how to practice deep exercise. It's not something that we learn when we're growing up. And while some have participated in yoga or meditation of some kind, it's still not really regularly something a part of everyone's day. And when you're experiencing panic, it can be hard to pick up a new thing to learn and to do. So I would say if you are experiencing those symptoms, don't overdo it by trying to add all of these components at once. But you might want to watch through all the videos and just see what the suggestions are for the 5 different areas that we can work on when it comes to reducing panic, and get started with one that feels easy or that feels kind of exciting or different for you. And you can add on the ones later as you move forward, hopefully getting to a point where you feel like it's not too hard to do all of these different components. It's a part of my everyday, just like brushing my teeth or drinking a cup of coffee or remembering to lock up and turn off the lights at night where you live. So, the idea for exercise really is to get our bodies in a fit place. And it doesn't really have to be the most fit person that you know. If you haven't been exercising and you feel overwhelmed by getting started, my hope is that this just gives you a very easy idea about what a good baseline looks like and how that can help you with panic. Um, First, I want to say you want to check with your doctor to make sure that there isn't any reason why you should not be exercising. And I'm pulling information from this really great book that helps people with panic attacks and other anxiety problems, the Anxiety and Phobia Workbook by Dr. Bourne. And um, in it, when we are talking about exercise, we need to be getting our heart rate up high enough so that our body is working. And that's different for every age range. But for 20 somethings, that would be a heart rate of 145 to 165. For 30 somethings, 138 to 156. So you might want to have something like you can either track it manually or through an Apple Watch or a Fitbit or something like that. So it may take some time to get up to a place of feeling like it's rigorous enough exercise that I feel like I'm increasing in my fitness. But I would say for starters to work on 4 days a week at 30 minutes of exercise. And to start with that, you might need a rotation of exercises that kind of keeps you engaged. Um, Really easy entry ones are rigorous walking, getting your heart rate up high enough so that it is actually doing something for you, jogging, riding a bike, using a rower, or swimming. And you want to make sure that you know what that ideal heart rate is for you and that you're keeping it there throughout the 30 minutes of exercise. If you're doing this 4 days a week, even if it's just the one thing, right? I'm just going to start with walking rigorously, tracking to make sure that my heart rate is in the appropriate range. Um, it does improve your mental health, and an increase of muscle mass is very helpful in terms of just balancing, and it does improve just the physiological things that we experience when we're experiencing anxiety and panic attacks. Um, Having better fitness will decrease your blood pressure. If you were losing weight, that is associated with less symptoms of depression and anxiety. You may experience less insomnia, and increased self-esteem. So these things are all really beneficial to how we feel on the inside and also how we feel on the outside. Um, and sometimes when we're feeling kind of out of the rhythm of exercise and not motivated to do it, we can cope with other things that are not healthy for us, like drugs or alcohol, just as kind of a way to numb the dullness or the sadness or the feelings of being low or the feelings of being too tense. Um, so it is interesting that with a regular exercise routine, it's often associated with less dependence on those things that we use to cope. So, as the second component for caring for your panic attacks, I do encourage you to start a regular exercise routine, something that feels engaging for you. And in this workbook, there's also a little daily record if you want to purchase the book or if you just want to kind of journal on your own, just tracking the day, the time of day that you decided to exercise, what you did, whatever activity, if it was swimming, the duration of the exercise itself, where your heart rate was on a scale of 1 to 10, your satisfaction level, 1 being, "This didn't really do much for me, I didn't really enjoy it," 10 being, "That was great, I feel so strong, I've had so much fun doing that exercise." And, you can also enter in a daily log if you haven't done any of those things. You can just enter the date and state the reason that you just didn't wanna exercise. Maybe it is illness or, a overly packed schedule one day. Hopefully, if you're aiming for 4 days a week at 30 minutes, you can manage it, right? And I think that uh, there are people that are like, even that at the 2 hours a week, that's really challenging to find. Maybe waking up a little bit earlier or cutting out some of the free time that you have after you're done working with your responsibilities for the day. So I do hope that is helpful to you and you feel excited and you feel motivated to get started exercising. It's just a way to care for yourself and to hopefully reduce your panic symptoms. Thank you.